Okay, so today's topic is about diseases of veins and lymphatics, which is your final exam question. And we mainly talk about the non-neoplastic diseases in this question because there's a separate question for the neoplastic disease of veins and lymphatics called tumors of veins and lymphatics. So here you need to talk about the non-neoplastic ones. So let's begin. So basically, like every question, we start with the classification. Here in the case, we start with the venous pathologies. The four main venous pathologies are varicose veins, also called varices, deep vein thrombosis, superficial thrombophlebitis, and SVC and IVC syndromes, which are superior vena cava and inferior vena cava syndromes. The biggest pathology here are the varicose veins, which we are further divided into superficial varices, esophageal varices, and hemorrhoids. So we start with the most common one, like in every question. And the classification for lymphatics pathologies is lymphangitis, lymphadenopathy, and lymphedema. We'll come back to it later. So we start with the varicose veins first. So, what exactly are varicose veins? They're abnormally dilated coiled veins of different etiologies. We start with the superficial varices, which is dilatation of the superficial veins, most common in the legs due to increased pressure, as we would expect because of gravity. They're more common in females than males. And what are the types? The types are primary and secondary. Primary is due to valve incompetence due to high venous pressure, and secondary can be due to other causes like immobility and pregnancy in most common scenarios. Um, and how do they look like? The morphology, which is very important, that's why it's in red here. Well, you need to describe the whole process of morphology to your examiner. So we start with spider-like veins, which you can see here, and then they cause pain and swelling. And if it gets chronic, it leads to chronic venous insufficiency. That means the valves become useless, and hence there's more stasis. More stasis means there's edema, there's thrombosis, and ischemia. Because it doesn't let the blood flow out, so new blood doesn't come in. And finally, that results in pigmentation, as you can see here, sort of maybe, and an eczema, ulceration. Pigmentation would be something like brownish, reddish, and then there will be ulceration gradually. So that is the end result of superficial varices, mainly in the legs. The second type of varicose veins are esophageal varices, or also known as caput medusa. Or caput medusa, sorry, esophageal varices or caput medusa, mostly due to liver cirrhosis and resulting in portal hypertension. That in turn results in portocaval anastomosis, rerouting, and dilatation of the submucosal veins, which finally leads to rupture, bleed, and shock, and then death. And esophageal varices rupture and bleeding is the most common cause of death in people with portal hypertension due to liver cirrhosis. And caput medusa is for the abdomen. So you can talk about these main etiologies: portal hypertension due to liver cirrhosis. Okay, the third most common type the third type of varicose veins are hemorrhoids. What are the hemorrhoids? Are basically dilatation of the venous plexus at the inner rectal junction. And the most common etiologies for hemorrhoids are hypertension, congestion, also associated with pregnancy, and strain and pooping. Risk factors are obesity and lifestyle, alcohol, smoking, low fiber diet. Very important to mention all these factors. There are two types of hemorrhoids, internal and external, based on the anatomical division because of the dentate line below and above the dentate line. And clinically, the patient will have symptoms like pain, bleeding, and itching. What's important here to mention are the complications, without which you cannot complete your answer for hemorrhoids, and your examiner will be waiting for the complications of hemorrhoids. So complications, like in every question, are very important. What are the complications of hemorrhoids? Most common: incarceration, basically twisting and strangulation of your bowel, and thrombosis, which will further cause pain. So it will be very painful. And we also divide hemorrhoids into grades. So there are like 4 grades, one being the mild one, and the grade 4 being the severest form. In the first grade, we have just bleeding mainly. And then in the second grade, we have prolapses when the person is defecation, and spontaneous retraction of the prolapse. And in the third grade, we have bleeding with defecation, but the prolapse does not retract on its own. It requires assistance. The fourth grade is prolapse and incarcerated. The prolapse does not retract back. So this is a pictorial representation of the 4 grades of hemorrhoids. Grade 1, grade 2, 3, and 4, the severest form. You can take a read. You can pause the video and take a read of the description of the 4 stages, so you understand better. Okay. The next venous pathology is deep venous thrombosis. Very common, very important. What is it? Thrombosis of the deep veins of the lower limbs, mainly popliteal, iliac, and femoral. Do not confuse this with superficial varices of the lower limb, which we had a while ago. This is a completely different etiology, pathology. Deep venous thrombosis. So what are the risk factors? Varicose triad, very important to remember: hypercoagulable state, endothelial damage, and abnormal flow. And what are the causes? Mainly heart failure, immobilization, varicosities. How does it manifest or present? Painful red swelling and Homan sign, painful dorsiflexion, which you will have it learned, I think, in propedeutics in internal medicine. This test for DVT. Morphology of DVT. Because it is a venous thrombosis, so we expect it to be red due to stagnation of the blood, and RBC enmeshed most commonly. So we expect a red thrombi in DVT, and the presentation can be obturative, which is complete, or parietal partial thrombosis or closure of the vessel. Complications are very important because it results in a pulmonary embolism, which in an acute setting can, if it is a big enough emboli, it can result in acute cor pulmonale, right-sided heart failure, or if it is a small emboli, then successively in chronic setting, it can become a chronic right-sided heart failure or chronic cor pulmonale. Okay, the last few venous pathologies to mention are superficial thrombophlebitis, that is superficial inflammation of the superficial veins. Mainly, it can lead to thrombosis if large veins are involved, and risk of embolism. What is the most common cause and location here? Well, it is due to IV cannulation. So wherever, basically on your arms and wherever the IV cannulas are inserted, there's a risk of superficial thrombophlebitis or superficial inflammation of your veins, of the superficial veins. Then you talk about superior vena cava syndrome, which is obstruction resulting in the prevention of venous drainage, because the superior vena cava does not drain the venous blood properly. That results in upper body swelling and signs of upper respiratory congestion. Very important to mention these two, because you can see these with your eyes itself. condition and upper body swelling. The etiologies most commonly are malignancies, small cell lung carcinoma, and non-Hodgkin lymphoma. Non-malignant can be thrombosis due to aortic aneurysm. Inferior vena cava syndrome, when your inferior vena cava is not able to drain the venous blood, and that is due to obstructions. Again, due to malignancies, tumors, but this time from the lower part of your bodies like hepatocellular carcinoma and renal cell carcinoma or hepatic thrombosis. Clinically, what do we see here? A lower limb edema and ascites, abdominal distension. So very logical. Just use your mind, and you can sort of tell them how the presentation of the patient will be, if it is IVC or SVC. Okay, so let's begin with pathologies of the lymphatics. The first and most common one is lymphedema. So what is lymphedema? Soft tissue swelling from localized escape of lymph into interstitium. When your lymph basically moves out of its vessels into the interstitium or the tissues. The two types are primary or idiopathic lymphedema, mainly congenital, or secondary obstructive lymphedema, more common. This results in increased hydrostatic pressure in the lymphatics, which results in lymphedema distal to the obstruction. And the most common causes for secondary obstructive lymphedema are malignant tumors obstructing the lymph node channels. Surgical removal of lymph nodes, very common in breast cancer treatment after radical mastectomy, and filariasis. Obstruction leads to elephantiasis, fibrosis, and hyperkeratosis. It is an infection with filariasis. Also for post-irradiation fibrosis in cancers, in cancer treatment. Complications and presentation would be something like orange skin or edema, mainly in breast cancer, because we expect it to be there in after radical mastectomy, and in limbs if it is filariasis. And then we also expect to see fibrosis and finally rupture, which can result in peritonitis, pericarditis, or pleuritis, for example, because of the leak of the chyle. So this is what you need to mention for lymphedema in your answer. And this is a typical picture of lymphatic edema. Orange skin appearance is the morphology, which you need to mention. Okay. The second pathology of lymphatics is lymphangitis, most commonly due to acute bacterial infection, erysipelas due to strep pyogenes, for example, or tuberculosis or syphilis first stage. The macroscopy is the red, painful subcutaneous streaks, inflamed lymphatics, like you can see here, and lymphadenitis, tender and enlarged lymph nodes. So you need to remember the three main causes of it, and the macroscopy. Erysipelas